the wanted to just, we're going to discuss the survey and the oversight committee concepts.
And the documents that Lori sent out.
Okay, we'll add that to the, that wasn't on the agenda, but we'll put it on.
Beverly, is that okay?
What was that?
That to discuss Lori's documents, they weren't on the agenda, but can we still discuss them?
You should be able to
David?
just make a motion to add it to the agenda and that will be reflected in the minutes.
So moved.
Okay, is there a
When
second?
the meet- did
Yeah, when the
meeting
meeting
start?
started.
The meeting's in order.
All right, do we have a quorum? We have Paul, we have Dr. Rodas, we have Nancy. And Kim, are you here somewhere?
You're muted, Kim.
Okay,
Here,
all right, so we'll call the meeting to order. And everybody got the agenda. Hi, Kim, how you doing?
I'm well. How are you?
Good.
Good, thanks, Linda.
The snow is all melted in our yard, thank God. All right, so we have the meeting, the agenda as published. Is there any additions or corrections to the agenda?
I think we just did that.
Well, we have to do it,
I
it's,
thought we did it. I said so. Oh, all right. So I
Yeah.
move that we add Lori's documents to the agenda.
and is there a second? Dr. Rodas, all right, so there's a second. Is there anyone not in favor? I'll just say that. Is everyone? Okay, so it will be on the agenda, but it'll be after the discussion on the Whiting Oversight Committee. And let me ask you this. So we could, the person from UConn is here, so we could start the discussion of the,
Sure,
All
I'm
right.
available.
hi,
Hi,
who are you?
hi. I'm Dr. Sarah Wakai. I'm an assistant professor at University of Connecticut Health Center, School of Medicine in the Center of Population Health. That's a
Okay, well, thank you very much, and thank you for your work on this survey. Would you
Sure.
like to proceed with what you've got here?
Sure.
And if there are questions, people will raise their hand and I'll recognize them. I like, as you're going over it, if they arise, would that interrupt you if we just took care of the
Sure.
question?
Well, why
then?
don't we, yeah.
Okay.
If if they kind of work themselves into the conversation, then we'll address it. And if it's something that we need to table to the end, then if you don't mind
Okay.
being flexible on that, I'd appreciate it.
All right,
So I have a little list of things I wanted to make sure I go over. I
Okay.
did get all of your feedback in the email, via the emails, so I appreciate you taking a peek at it before our meeting today. I just as to give you a little update, I did receive email addresses from Mary Kate for the GMIS employees, so I have that. So that's a big undertaking. So thank you, Mary Kate, for getting that to me. Also, as we're doing this, I also wanted to, for you folks to keep in mind that I'll need the task force to draft an intro letter and email it out a day or so before we actually email the survey. I'll also ask the task force to decide on who the contact person should be if a respondent has questions about the survey. So this is our intro. I think you all received a copy of it. So we have our introduction to this. One change, I will say that we're going to keep all of the responses anonymous because we can do that. I wasn't 100% sure when I initially draft this cover email or cover letter. So, but we can keep them anonymous. So I'll change that. And then I would like the task force to help towards the end of the cover letter. It says that Yukon Health is conducting the survey on behalf of the Whiting Task Force pursuant to PA 1886. And the task force will use the result from the survey, to make recommendations to the Connecticut State Legislature. If you find that acceptable, that's fine. But if you wanted to, because this is kind of like what you're going to do. So I don't want to put words in your mouth. So if there's something you would like to edit there to be more informative, if you like it to be kind of general, and then if folks have questions, they can always contact someone on the task force. So I just wanted to get your folks' opinion on that now.
So you're asking if we would have a problem with that, your proposed language? Does anybody have an issue with that? No?
I like that, and I think it can dovetail nicely into what we're going to say in the cover letter that we're going to send out
Right.
a few days before. Yeah, no, I think that sounds perfect, but
Okay.
hear what others think.
Okay. And let's see, Lori, did you have your hand up?
I did. I'll just echo what John said. I thought it was short and to the point. It references the statute if someone wants to look it up, but I think that's clear without getting into too much detail.
Okay. And I would appreciate taking a look at the cover letter you're going to send out.
When will you need this cover letter?
Well, I would like to, we have to figure out when this is ready, and then it needs to go out like a day or two before. So we'll just have to kind of back time it as soon as, we
Do you
get.
have a launch date for sending these out? Have you?
Well, I mean, I'd like to do it within the next couple of weeks. I mean, but it depends upon how our conversation today goes.
Okay.
If people don't like it and we're starting from ground zero, it might take us a bit longer to launch it. Let's see. All right, so we have the two screening questions. We have the demographics. I might move the demographics to the end. I'm debating on this because then we could get more of the kind of content specific questions first. And then if people, because it's just human nature, folks are going to, the longer a survey, even if it's only 10 questions, people are going to, response rates are going to dip towards the end no matter what. So then we would lose the demographics, but we'd get the kind of content specific, so it's a fine line, but I think that might, we might do that. And then we have the Hispanic, Latino, and the race. I think somebody mentioned that. So we can take out question 5 and just have question 6 and just ask about race. Or we could take out, I think the Hispanic or Latino in this, I think that was an autofill from SurveyMonkey, because originally we just had, we had Hispanic, Latino wasn't in there. So we can work on that. Someone had a question about where, question 7, where do you primarily work? And it had to do with the different buildings. Some folks wanted to be able to, someone suggested to have it check all that apply. So this is something I have to ask for guidance from the task force. Is there a scenario where, is it very frequent? Would we be reducing anonymity if there could be somebody who would, if it's only very few people who work in more than one building, if you wouldn't mind helping me talk this through so I know the pros and cons.
So Dr. Hauser, you may be able to help us with this.
Yeah, so everybody has an assigned workstation, like as part of their job classification or job role. However, I think it might help to add, at the very least, to add under like addiction services and general psychiatry, add another option that says both ASD and GPD, because and the same thing with Whiting under Dutcher and White under Whiting Building and Dutcher Building, to say both Whiting and Dutcher, because there are certainly people, for instance, at Whiting who work all over the hospital, doing psychotherapy or neuropsychology or the pharmacist or, you know, things of that nature that are sort of hospital wide. There are other staff who are specific to a given building, and that's where they work. So I think it might make sense to at least provide the opportunity for both options.
Now,
Lori,
is
I'm
there
sorry.
something-
Sandy, I'm sorry. Lori, would it be easier to say check all that apply?
We could do that, yeah.
Otherwise, you're gonna have this panoply of all these multiple choices. So these two
Right,
buildings,
right.
these three buildings, you know.
And is it important to know that somebody works for the ASD and or the GPD versus just working at Connecticut Valley Hospital? That's important?
Yeah,
Okay,
yes.
so.
all right,
ASD is very different in the sense that it's a short-term acute substance use. People are there for either, you know, short detox or 45-day stays, whereas GPD is much more long-term. It's more strictly psychiatric in nature. So it is very different work. So I think it makes sense to do that, to kind of outline the things and check all that apply.
okay.
Well, but I'm wondering if that designation is overbroad in itself too, because within general psych, there's young adults, there's geriatric, there's different groups within general psych that might come into play.
That's true, but I guess I think it's a matter of like kind of how finely we want to carve up the data.
Have to
You know,
be
is it more
careful.
important that we're kind of getting the content responses and kind of getting a sense of how workers feel, as opposed to, you know, this is coming out of Woodward versus the Merit Yaz program or something like that.
Well,
But-
and it kind of just circles back to how are you going to use this data? Like, why do you want to know that information? And it's fine with me, like, this is your survey, so we can ask however you want to ask, but you have to stop and ask yourself, how are you using this information? Is it vital to get that granular?
No, it could be detrimental, actually. I think when you get too granular, then I mean, the adolescent psych, you know, program over there is a problem. You know, I think we actually want to stay. We're looking for broader, I think, systemic issues.
Right.
Not necessarily, you know, the manager on that unit is really stinks and that's why it's bad. You know, I mean, we're probably gonna get some of that anyway. That'll be
Right.
I mean, obviously I've done a zillion of these surveys over time, and I just think when sometimes you get too granular, you start to lose functionality, I guess.
And I think that even happened in some of the, you know, one-on-one meetings we had. That's why I think it is important in this point to make it really about the bigger picture and to have it worded so that people will kind of be able to really say, in the system, this is what I see, not just in this little part of their own world.
Right. Okay. All right. So we're going to just keep it at these kind of 4 options with a check all that apply response option. Okay. So, and also, can you take a look at the primary professional role? I just want to make sure that we are representing everyone accurately, using the correct terms that, you know, the
What
terms.
page is, what question is that?
8.
8. Oh, okay, thank you.
Yep. So, and then also you don't want managers? Did I read the emails correctly?
I,
I mean, I to be honest, I wasn't sure when we started whether we would include everybody or not, but I think Paul mentioned that in one of the emails, and I can see why. I mean, the task before us is to investigate worker morale, management, instances of bullying. So it's trying to get the employee's perspective of administration. So I can see excluding them from it.
it would also, though, be interesting to see the difference in the responses between managers and line staff. Managers think everything is hunky-dory, and the line staff go, this place is, really hard to work in. So I'm not sure, maybe it would be worth it.
Yeah, I mean, I think there's value in having the managers. My only concern is that there's going to be so few of them. But
How many are
because
there?
how many, it sounded to me like there was like 5 or 6.
Probably, yeah, 6, 8, maybe at the most.
I think, I actually like the idea of including more than less in this one. And I actually think my suspicion, not to preordain what we're going to find here, but typically in my experience, the managers sing from the same hymnal as the administration. And and I think that is telling in itself, right? If they all say, yeah, it's great. This is a great place and I feel satisfied at work, and everyone else thinks it's miserable. That actually is an issue in and of itself, that disconnect. So I actually find value in that. I don't expect to get meaningful stuff from the management, except to find that, oh yeah, they're aligned with, there's a disconnect between them and the folks that work for them. But I could be wrong.
Just as a point of clarification, though, there's no distinction between managers and administration. Like that's one and the same. I don't know if you were referring to them as 2 different things, John. but-
No. Oh, yeah, I understand. Yes, thank you for clarifying. I understand. I got it. Anyway, my vote is to have, all employees, basically, anybody who's there, and then, we could disregard whatever we want.
But at this point, I don't have the email addresses for managers if they're folks from Yale, because I only have Demas people.
They should all have a ct.gov email as well,
They do? Okay,
the same as the rest of us, their first and last name in ct.gov.
okay. All right, so I have all their emails and we have an option for them to check that. All right, so if you take a look at what we have listed, you find these acceptable terms and people will know who they are and that they can, and we want primary role. So select one category that best describes your primary professional role. Okay.
The only comment I have on that is like the Demas police. I don't know if that needs to be separate or if that falls in with the facility operations under security. And if it would be better left there because that would provide less isolation of that particular group.
Well, I think it would be interesting to just have them as the Demas police and not, what was the other term you thought they might fit in?
Security is listed under facility operations. So dietary, housekeeping, maintenance, security, transportation.
I think security should be separate, is my own vote on that. I think
So then we should
the
take
folks
it out of
the
that.
folks who
other group.
clean the place and wash the dishes
Right, it's very
and are
different.
very different. They have a different role, and especially since the stuff we're kind of concerned with, I think security is probably very important to carve out. But again, my
Okay,
opinion.
so I'm going to take security out of facility operations. Do we add it to Demas police / security, or are they the same thing? Or do you only have police?
Same thing.
Okay, so no need to add anything. Okay.
I had a question. Paul, what do you think about having the recovery support specialists grouped in with outreach, faith, family support?
So the thing is, there's so few recovery support specialists that it would be pretty easy for people to figure out who said what.
Okay.
I think Whiting has both of them.
Okay.
Okay, that answers that.
Yeah, so I think the more that we can put that group into,
Is that the right group for them to be in?
family, what was it? Family.
It's outreach, faith, family support.
So I mean, honestly, I would like, Lori, how big is that group of a workforce? Is that another 2 people?
As far as the outreach, faith, family.
Yeah.
Yeah, yes, it would be tiny.
Yeah, so
We're not-
you're still gonna end up with 4 people.
So maybe they should all get moved somewhere.
You got to be careful when you get to these really small groups, because I think what's more important, the most important thing for us is to actually get a reasonable response rate. As it is with your surveys, you get 25, 30% of people, and the smaller the cohort, the less likely they're to respond, because first of all, they're already suspicious about anonymity. Anyway, nobody believes that. They'll think somehow the manager's going to know what they said. And when you get to really small groups, I think
Yeah,
they're
that's why I'm
even
thinking
more
move them
concerned.
someplace.
But would
At
it
least
would it
4 or
would it
5 of
make
them.
sense to do like a frontline, a supervisory, and an administrative breakdown as opposed to each job title?
Or lump them the way Nancy says. It's a lumping opportunity here. But I don't know, Lori, I don't know enough about the jobs to know what could be lumped together.
Right.
So
mean,
that people don't feel like they're being identified. They're going to figure out who I am now.
Like possibly with the occupational, physical, educational therapy, because those are tasks that sort of operate more around the hospital. They're not like a specific member of each treatment team. They're, they're brought in when they're needed or for additional support, that kind of thing. So that's, maybe a group that would, could absorb them. I mean, there is also the, prefer not to answer option. But of course, folks are probably less likely to select that than to just abandon the survey in general. So it might help to lump them in with some other group. I'd be reluctant to lump all like what's called frontline together, because there's so many different permutations of the work that would be, I think, too big of a group.
I like that version. I like that version you said, basically like that support staff, folks you bring in an ad hoc basis that kind of made work in multiple places. I love that. I like that idea.
So the occupational, physical, rehabilitation, educational therapists. I mean,
Right.
technically the rehabilitation therapists are a member of each particular treatment team. But they, if we want to carve them out separately, that would probably be the best group to fit them in with.
Okay, so tell me what you want to do.
Move the support and outreach group to occupational, physical, rehabilitation, educational group. Make it all.
Okay,
do
the
you-
support.
you
Support
think
and
that
outreach
melds?
group to the occupational, physical, rehab, education.
Yeah.
Support and outreach goes there. And do we still call it support and outreach?
I mean, occupational therapy, rehabilitation, and educational therapists, that's what you want to put that support and outreach there?
Yeah, I would just add it to the end of that group.
Well,
Just because, as I described, they're folks that aren't, with the exception of the rehabilitation therapist, which is a member of every treatment team, those other entities aren't specific members of every single treatment team. They're services that are brought in ad hoc if they're needed. Not every patient, is in need of those services or all of those services. So they're considered ancillary to each treatment team. But they also are there to provide services and provide care, and they work with the patients, and they usually work all over the hospitals and that kind of thing.
Well, reason I ask is because outreach, faith, family support, recovery specialists, that really it's another view of the process, the continuum, where they're actually working with, helping the families, helping the patients with bringing them in, recovery support specialists. That when you talk about occupational, physical, and rehabilitation, that's a part of the more concrete treatment, where this is working with families and not necessarily always with the patient.
I mean, to be fair, I'm not even sure what outreach and family support are there. Like, I can't identify anybody in those particular job classes. I don't know if that is the same at CVH, but at Whiting, the people that work with the families and through family support are the social workers on the teams. And so I'm not even sure what some of these are, and they're things that exist only at CVH, but the faith, you know, there's one, maybe two for the hospitals, you know, and as we were saying, yes, they're different things, they're providing different services, but they're so small a group that we don't want to leave them isolated so that they can be readily identifiable. We got to lump them with something else.
I mean, I think just on the recovery support specialist, Linda, I think between CVH and Whiting combined, there's 5.
Yeah.
And I'm not even sure if CVH is completely hired up on that. So there might be 4 or 3.
Yeah, I think they're in flux. You know, there's that many positions, but there's not that many people in them. So I think we have to sacrifice losing, again, just like the last question we were talking about, we have to sacrifice losing some of that granular level to be able to protect people's identity, make them feel more comfortable completing the survey, and getting, you know, their responses on the content.
I would ask the maker of the survey about the concept of not having enough and enough people answering a category. The option of maybe collapsing some of these and folding them together. Is that
After
something
the
you
fact?
consider?
You mean after the fact? Well, what we would do probably is we do suppress cells. And so, and sometimes I talk in kind of dorky research language, but what that would mean is like if a cell, like if you think of a table, and so every little like box would be considered a cell. So often if a cell is below 5, an N of 5, then we just suppress it. So we would just put like an asterisk and just say, you know.
But the answer would be lost to the survey because you collapsed it, or can you fold it into?
Or we could roll it into other.
Yeah. Well,
But that would only be when we are looking at responses based on something by, like if we wanted to do gender and job professional category. But overall, it doesn't really matter, right? It's only when we're trying to run the analysis by something that's going to be either one of these identifiable characteristics, and when they start getting, you know, granular. So you can either put them together now, or I guess we could collapse them later. But you know, if you look at how many, I was given this list of how many people are in different job classifications. So like forensic nurse, there are 37, and this is just at, I can't remember, it's not on this printout, but I can't remember if this is Whiting or CVH, but it's one of them.
Not CVH. If it says
Not
forensic
CVH.
nurse, it's
Okay,
Whiting.
so this is Whiting. Okay, so we have, you know, forensic nurses, there are 37, forensic treatment specialists, 120, mental health assistant 1 is 105, nurse is 40. So everything else on this teeny little, on this long list written in very small font, you know, there's like 10, 1, 2, you know. So, and we kind of collapsed those. So, but nonetheless, it's primarily going to be people who fall in nurse, forensic nurse, treatment specialist, mental health assistant. Like that's going to be your vast majority of folks, everybody else. And so again, you have to kind of circle back to what are you going to do with this information? Do you know, are you going to have different training programs? Are you going to, you know, for different job categories? Are you going to make different policy decisions? Are you going, you know, so that's where you have to kind of stop and think, how am I going to use this information? And doesn't matter how granular I get at this point, but we can collapse things after the fact.
So let me ask you this, if you followed the suggestion of the group, and would you just take those titles and put that along with the occupational, physical rehabilitation, educational therapist, support and outreach? Would you delineate that in that category as it stands now, so people would know where am I?
I would have no objection to combining those on the survey.
Okay, just so, they know where they go.
Does that sound, is that the consensus here? People are comfortable with that?
And just as a further comment, that we want to make sure that we make it where people are going to be comfortable to complete it. So yes, we could always collapse things later, but if if the way it looks prevents people from filling it out, then that doesn't do us any good. And if people feel reluctant to, they won't complete it. The other thing is, we're not going to be asking Sarah to run, ANOVAs and t-tests on every single answer according to all these different job categories, like to splice out what do support staff feel versus psychologists or whatnot. We're going to be looking at kind of broad strokes. This is more to kind of be able to provide a description of the sample to say, it consisted of these types of individuals, this percentage of the workforce, and those kinds of things.
Okay,
I totally agree. Lumping has a lot of advantages in this particular regard than splitting, particularly for the reasons Laura just said.
Okay. All right, so we have, and then question 9, full or part-time. How many years employed? That will be an open numeric value only. We have the different shifts.
Can I ask a question on that, Sandy?
Please.
Why? I was surprised that you did that as kind of a string data. I mean, where they're going to put 1 year, 2 year, 3 years. Normally, when I've seen surveys, certainly feel that way, Sharon, you get that, kind of 0 to 4 years,
Right,
5
so
to
the
9.
reason, yep, no, I hear you. The reason why we did this is because of the incident that happened was in 2018, 2017, 2018. And we wanted to see if there's anything that, if people who worked before the incident versus people who worked after the incident, and if there was anything significant, if we could see if there was something significant having lived through that or not. So that's why it was hard. Like we kept trying to go like, well, 1 to 3 years, but and we were trying to do and so then we moved to this. That was our rationale.
I guess that makes sense, although I suspect Paul's thinking, and I would agree that just because the incident, as you say, is maybe what brought us here today, but the reality is most likely the environment and the culture and the incidents have been going on for quite a while, and that's the one that just got to everybody's attention. It would be my guess. So, but I understand the answers makes sense to me, so that's fine.
Yeah. Like if somebody was, had only been here for a year or two and didn't experience that, maybe there are changes.
And that would be helpful information, guys, right? If the people who've been there less than 3 years all say, oh man, this management's great and blah, 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 and everybody who's been there longer says something different, that might say that really the new management has made some sincere efforts to make things better, and maybe it is better.
Mm-hmm.
Thank you.
Yeah, thanks. Now, someone had a question, is everyone on the same pay period? I'm looking at question 12. Someone wanted.
That was me. I asked that because I know at least, I had 5,000 employees, so it was all over the place, but typically the lower paid folks, transporters, environmental service, folks that are cleaning the place, people that are washing dishes are on a weekly payroll. And then a lot of other people on bi-weekly or bi-monthly. So I'd say no, it was a question really for, I guess, HR or Lori, if she knows. If everybody's just on a bi-weekly, then I think you're good. I just wanted to make sure that they were separate, that you wouldn't miss something there. Lori, do you know?
It's all bi-weekly.
The state is almost always bi-weekly.
I think we're safe saying a period.
yeah.
I have a question though about 11. If someone's been a long-time employee at CVH or Whiting, do you want to say something about which of the following best describes your current schedule as opposed to your usual schedule? Because people could be changing and.
Yeah, I'm flexible on that. The only thing with current is like, if they think like, well, in the past 2 weeks or a month, I've been working night shifts, but that's only because, I've been helping somebody else out or because they're,
People are designated to a particular shift. So as your primary, primary workstation, primary identified job, you may work overtime on other shifts, but if you're a first shifter, you're a first shifter. It doesn't rotate. It's not like some other, like police schedules and stuff that change every so often.
Yeah, I don't care if they sound synonymous to me, usual, or, I mean, I
Well,
do
it's
get,
just that if
only
you-
that
Yeah,
fluke of
current's fine.
somebody this week was just been assigned to do something different than all the rest of their job. But
Yeah,
it sounds
but-
like that's very unlikely.
Yeah, and if it's usual, and if you've been working there 10 years and you had a schedule for 5 years, then another schedule for 3, another schedule for 2, I don't know if that's just too confusing.
Well, the other thing is, please keep in mind that we are asking folks to focus on the last 6 months when they're responding to the, returning to the more, what I'm referring to as the content questions. So perhaps we could have them, some of these things, I mean, we could ask, emphasize that, although some of these things are going to kind of sound a little odd, if it's looking at the demographics, but.
I think one of the things that came out was the mandatory overtime. We heard some of the people that are working today talking about the mandatory overtime that they're required to do. And in many respects, it was kind of unsettling to see that some of them are working so much. So I think what we want to try to do is, I mean, some of the reports, I'm just saying, some of the people reported, and I'm wondering if it, when you say in a typical pay period, do you work over, you have the mandatory versus the voluntary. That's a real important, I think, thing to try to get a handle on, because when we heard from the people that were working there, I was kind of astonished. So as a nurse who work shifts a lot, that they kind of mandatory overtime that they are required to do. So it's an important thing. So,
That's question 14.
right.
We're getting bogged down a little bit, but I think we're fine. I mean, if you want to make the change from usual to, or whichever way you want to say it, and I think I agree with Linda, the point about mandatory overtime was a huge issue and it is important, but then we'll figure it out, right? My usual shift is the day shift, and I'm doing a lot of mandatory overtime, right? We'll figure it out.
Because patient care obviously suffers when you have a lot of mandatory overtime, and some of the things that were described were troubling.
And staff burnout and staff turnover,
Right.
and then more overtime. It's a vicious cycle. Yep.
Okay, so, right, so then we have the question on hours of overtime, the mandatory, voluntary, and the amount of percent of patient care per week. I don't know if you want to go through each one of these questions.
I don't think so. I
Pretty,
think
I think we've all done. I'm
forever.
going to guess everybody in this room, anybody that's call has answered these surveys, and they seem pretty typical to me. I would say it's almost right out of the cookbook. It's perfect. Covers your bases from all the angles.
Okay.
It's my opinion. Again, I just
The only thing that I would suggest is swapping 81 and 82 and making the box bigger. That's a part of 81, so that if people want to actually like.
Oh yeah, I don't know that should have been, that must have been a typo. I'm glad you caught that. Yeah.
I think
Yeah.
there was another part too, 46 and 45. I didn't know if those were flip-flop, because it looked like number 46, it was 44 was I have experienced violence or physical abuse. Then it goes to this yes or no question. Then I have experienced threats of physical abuse. I don't know. I just thought that
Yeah,
the yes or
yeah,
no question
yeah.
made more sense.
Yeah, I apologize. That must have been just some kind of a data
Yeah.
entry
yeah.
glitch. Okay, fix that. Thank you. Yeah.
And then is 47, is that like an if then question related to 45? Like, so 45 asks yes or no, have you experienced negative behaviors? Is it like if people answer yes, then they break it down further?
I
Or are
think
people
that
going to answer
was-
that question regardless?
Yeah, no, I think it was, yeah, there's a skip logic. Have you experienced any negative behaviors from people you work with? And then, yeah, so then there's a skip logic and it'll go from 45 to 47. I mean, once we fix, we'll fix it, but it'll go to 47 and then
Very next
who are the source, kind of the source and the frequency. So, and based on the legislation, go ahead. I'm sorry.
I
After
just
you,
have one
Laura.
other point or question about the part 3, different places where it references my manager. So manager is singular. I don't know if we want to make that plural or change it to like the more sort of an entity like management, because people don't have just one manager. I mean, like if we're trying to get a sense of like the administration, the management itself, we might want to refer to it as the management. Otherwise, people might confuse it for supervisor is what I'm getting at.
Yeah, right. And that is also one of my my questions. Will respondents consistently know the different definition for supervisor versus manager? So I just want to make sure. So, okay, so what would you, so I'm looking at
But
what question.
they would know the difference, because I don't know that people do.
I can tell you that at Whiting, at least, and I'm guessing this is probably the same at CVH, people have direct supervisors and they'll refer to them as their supervisors. But when we refer to the management or administration, like those are the two words that are used to signify anybody that's not union, essentially. So the folks that are in charge, the ones that are making decisions, it's either the management or the administration, like those two terms are synonymous and those are distinct from supervisor. And I think that people will appreciate the difference between that.
I think that's important. I've had a few surveys where people were confused with management because I was the president, but there was a layer of stuff above me and there was a layer below me and there was a few layers between, I'll call rank and file. And when they said, and I really want to know about their direct manager on some questions. In other cases, I want to know about the leadership, right? And I think it can be tricky. So I think these points are important, Lori. I think as long as, the staff and who their supervisor is. And I think if it's supervisor / manager, your supervisor / manager, that sounds different than the president of the place, or the CEO. That's definitely not the person, right? Unless you're the senior executives.
Again,
So-
I think given the nature of the charge from the statute that says, it's looking at worker morale, management, instances of bullying. I mean, I get from that the sense of like, we're trying to figure out how the employees feel about the administration, about the management. And so I would kind of keep this whole part. I would use the word management.
Okay.
In this section. Then at the end of it, where you do break down supervisor versus manager, I think that's clear. And I think maybe if like this is between 75 and 76, maybe even just a sentence in there that says, please answer the next several questions separately regarding your direct supervisor versus management.
Perfect.
Because then that'll also signify to people that, we're talking about these
Right.
different things.
I love
Right.
that.
I was actually thinking maybe earlier on to do something with defining management and supervisor when they start, because the questions about management come and then the supervisor comes. So maybe when they start talking about management, have a definitional section of what management is and what supervisor is, so you don't make any assumptions.
Well, I just think that we should use their language, what we already know though. So if we know it's supervisor and we know the staff know that's different than management and administration.
Okay.
if you say direct supervisor, people will know that that means their direct supervisor, and those people are considered part of the rank and file. Those people are union, those people are part of the workforce, they're, so I
So
think
should
that
it specifically say direct supervisor?
I can
that would
change
make it
that.
clear.
That
Yeah.
would help. That would do
My
it.
direct supervisor, yeah.
Okay,
Yeah.
my direct supervisor. Okay.
So, and that, again, I mean, you could put definitions earlier on, but like specifically where it starts to break down between supervisor and management, I think it's good to have that line there that says, please answer these questions separately, your direct supervisor management.
Okay, that'll do it.
Okay. Any other feedback? This has been very helpful.
I have a question about the whole schedule of questions. You are kind of honing in on only the last 6 months, right?
Yes.
And I am wondering where you're talking about some of these, for example, I'll go back to overtime. Is that stated forthrightly before, in the beginning? Was any surveys ever done before the last, and past the last 6 months before then? Did anybody do anything to like take the temperature of the staff before
I
changes were
didn't-
made?
Lori, didn't Perch do a staff survey right after the incident?
Yes.
Yeah.
I think it was the following summer but yes. And I've referenced that before. They actually, Demas did make that available to us. They sent a copy to us. That was the survey / focus groups that were done. Both patients and staff had opportunity to respond, and then they, kind of did a report outlining different themes from those discussions. So.
Kim, you had your hand up?
You answered my question. I just didn't know if, and I may have missed because I've missed several meetings, did we go over that survey in our group?
No.
We didn't go over it in our group. It was made available to us. We didn't like discuss it but I think it will provide a useful
Almost like a
context or
baseline?
backdrop or whatnot once we get the results of this survey, because there were similar themes touched upon in that study.
Yeah, that's what I was going to say. We should kind of compare them once we get the
Right.
results.
So Dr. Sakai, have you seen that?
No, but
The
I
Perch-
can take a look at it prior to finalizing this, just to see if there's anything in there that we're missing in this one.
Right, because that would be pretty telling, and it might also inform the process better. So yeah, looking at what it was then and now. And I
For what it's worth, I've asked probably 17 times that we try to get those folks back and do a follow-up focus
Yeah.
group to kind of see what has changed over the last couple of years, and it just for various reasons, not the least of which the pandemic, but it just hasn't ever materialized.
So who has the Perch test? Do you have that, Lori? Or who has it that we could look at it?
It was made available to us, but Mary Kate should be able to provide it to Sarah, I would think, since it was a
Yep.
Demas,
Yeah,
report.
I'm gonna look and see if I have a copy. It sounds like something that I've been informed about, but I'm not sure if I ever got a copy, but I will look. But this has been very helpful. I appreciate it. So I'll make some of these, I'll make these updates. And then, I can send it to you folks electronically if you wanted to click through it. If you're kind of done with it, I will respect that as well. You can let me know what you prefer, or I can send it to you. And if you don't click through it, then you have that option.
Well, I think we should ask the members of the task force, would you like to see this before it goes live?
Sure.
Sure. And since there's a couple people that are not here, maybe that might be a good thing to just, not that we want to disrupt the flow of the dissemination of the survey, but that people would have a last look. Appreciate it.
All right.
Sarah, has anybody been identified to do a pilot of this survey yet?
Well, that was also a question on my list here. If you, if the group clicks through it, then it will help in terms of like the functionality of it. In terms of the content, it would be nice to have folks who will not be respondents, but would still represent the potential respondents, the sample, so to speak. I have some contacts that they're colleagues or of mine that I could ask to click through it.
Sure, we're happy to do that. I mean, that really, like you said, takes 10 or 15 minutes.
Yeah, and that's a good point. I'm glad you brought that up, John.
We'll answer regarding the chair and co-chairs of the committee as our management. We'll see.
Well, I don't think I've been too
So
bad
limit
with,
Mike. Actually, let's just survey Mike since he's not here today. We'll just
and John, you kind of mentioned the time, and according to SurveyMonkey, the survey should take 13 minutes to complete.
oh, good.
For what it's worth.
I'll do it in 12. Just to show
All
you.
right, there you go. I like that.
It'll take 13 minutes until they get to the last box.
Yeah, that's true.
And then they'll have a lot to say, huh?
Yeah, no, it's the most meaningful. Sometimes the most meaningful information comes from just raw comments. I'm hoping actually that people do take the time to fill it out.
One thing I had suggested to Sarah in the past was, and I don't know how, I don't want this to take too much time. So if it's too labor intensive, I wouldn't recommend it. But I suggested that perhaps recent retirees would be a good group to pilot the survey on, because they're people that were just there, had experienced what other people experience, and so they'd be, but they wouldn't be able to participate in the survey. So that's an option, but certainly we can get by without doing that as well.
Would how recent? Like Will Brady recent or Pat Gerard recent? Because Pat Gerard was like 3 years ago. Will was like,
yeah. I think in the last 3 years, I would think.
Yeah.
Because they'd be able to, look at it from a staff's perspective and know whether the content makes sense, from their perspective.
I just heard I got a text from Mike Lawler that he's feeling under the weather. So, and that he's obviously seen the instrument several times. So he's good with it.
I would recommend, in response to your question, Sarah, at the beginning, I would recommend him as the contact person for questions, just because he is the liaison, like, with you. So it probably makes sense that he be the one on this identified on the survey if participants have questions.
All right.
So is there anything else we need to go over with this?
We should just, we don't need to do it with Sarah here, but we should soon, Linda, maybe you want to talk to Mike just to get a draft of, I don't think that needs to be very long, our opening letter to the employees, just say, it's clear, because we can take the language from the statute, from the legislature about what our task is, what we're doing. I'm thinking 3 or 4 sentences, but we should we should start
Yeah,
working on that
I'll
sooner
tell them
than
that
later.
we've.
We don't want to hold
we-
Sarah up as far as rolling this thing out.
No, we don't. So,
Something similar to what we put out when we invited people to come and speak to us. Would
Yeah,
really,
that's a great place to start. Great point.
Yeah, I would think something that is more kind of encouraging and you know, positive, like we really, you know, value your input, kind of that kind of thing, rather than, you know, the legislature, I mean, you know, I know you would kind of wordsmith it a bit, but that the legislature is a little kind of heavy to,
Yeah, I just meant that as a opening, you know, we have
Yeah.
been asked, we've been at this for a while, but and then your point's very important. Yeah. We really care about what you think. We really want your opinion, and we assure you your results, your response to be held anonymous. And, you know, I think that's the gist of it. That's all.
great. All right, well, I certainly appreciate all your time and the opportunity to work on this survey with all of you. And so I'll early next week, I'll have an update and I can get a link out to you folks.
Great.
All right.
Great.
Thanks, Sarah.
Thanks
thank you so
again.
much.
All righty, take care.
Bye. Okay, I am wondering, is this meeting supposed to go to 3 or to, I have 3 on one of my
It's
3.
3
Okay.
o'clock. It's 3
All
o'clock.
right, thank you.
Yeah.
All right, so we can move along and talk about the CVH Whiting Oversight Committee. I think one of the things that was touched upon in both of the written responses that we're going to, that's the 3rd item on the agenda. But I'm wondering if I am out in left field here, thinking that the Oversight Committee was supposed to be have much more authority than just getting together every quarter and talking. And I thought,
2 separate groups, Linda.
okay, tell me
there-
about it,
there's-
fella.
So what I understand is Lori's proposing that there's a group that meets quarterly that talks about these issues, and the oversight committee is kind of like the board. We're kind of looking at it as kind of like the board of directors of Whiting, and that have a certain makeup in itself, right? At least that's my understanding from what I understand of what Lori said.
yes, yeah, the thing I was referencing in the about competency restoration had nothing to do with like the inspector general piece in the Whiting
Okay.
Advisory Board or the Oversight Commission or whatnot. I meant, I think it's wise for basically everyone in the state that has something to do with competency restoration, from, you know, judicial and DEMIS and DOC and other aspects of the, you know, mental health and criminal justice systems. Like, I think it makes sense for folks to talk on a regular basis about how changes in one part of the system are affecting the other parts of the system, and, you know, trying to understand you know, what the logistics of things are, and trying to find other ways, like such as the, you know, not to get in too far into the competency stuff, but increasing opportunities for jail diversion, getting people to, you know, to not use competency restoration as a way to get people treatment. I mean, stuff like that. So completely separate group of people is what I'm talking about.
So this would be more like a policy, excuse me. Policy, or would it be more like the day-to-day issues that come up within the facility that need to be addressed by,
That would be the oversight committee. I think what Lori's talking about is like getting people from DOC, from DEMIS, from all the different agencies that are involved in, from judiciary, from, you know, even housing, to start to talk about how they can work together to kind of reduce the strain on competency restoration.
It's so much bigger than DEMIS.
But is that what you're saying is the oversight committee?
No, no.
No, okay, I want to make sure of that, yeah. I
No,
think-
Set that piece aside until we talk about
Yeah.
competency restoration. It just-
Yeah.
I think it's good that folks that work in all these, something to do with all these factors talk on a regular basis.
That should be a general.
Not a
recommend-
time limited, task force like this is, but like should be an ongoing thing that we talk about moving
So
forward.
does Demas have any existing structure that pulls the people together at all?
Well, it doesn't have to be Demas. I mean, I think maybe it has to come from the legislators or something where it's kind of required that all these different departments do get together.
Like Mike talked about
I'm
the CJ PAC, I think is probably the closest example, because it pulls, again, it's like, the commissioners are their designees from like all these different agencies. So it's something like that is kind of what I'm envisioning. And yes, in some sort of informal ways, we're starting to make these connections and have these conversations, working with folks in the state's attorney's office and the chief administrative judges, and talking with people in the DOC. I mean, so people are doing this already, but I just think it should be more formalized and kind of metriced and have more substance to it. But again, and that's sort of talking about the competence to
Right,
speak
and I
about the
obviously
oversight
didn't
commission.
get that distinction when I was looking at this before, so, yeah.
No, and I even think, Lori, that they could take a look at the Behavioral Health Oversight Council, where they actually have a representative as one of the tri-chairs, so that like someone from judiciary or public health or both, kind of sit on this committee as well, so that they can report back to the legislature. So that there's that level of involvement in this.
So you're looking at, this would be an interagency.
Yes.
I mean, they've done this in the past with housing and things like that. I'm wondering if that's what you're thinking is, would be interagency chaired by who?
People.
They
Not
could
to be
elect
chaired
a
by
chair.
anybody.
Yeah.
They could elect a chair,
Everybody kind of coming together to talk about these things. And,
Yes,
as an
Tim.
example, I think, Dr. Norco's been trying to talk with the chief administrative judges around reducing the utilization of competency for misdemeanor offenses, and then just trying to explore that and trying to figure out ways to more options to involve jail diversion at more points along the process. I mean, those are some of the things that are sort of already in the mix. Those are the kinds of things that I envision. I just think that when one agency doesn't know what the other agencies are doing, or sometimes people they confuse Whiting and CVH. Obviously, that's going to happen for a while because we just separated a couple of years ago. But
this has been out there for years and years and years. So it feels like we do have to recommend not the body who it is, the person's name, but that it is a governing body, whether it's the governor who this is his thing and he has to send his representative, and that it's really mandated that these organizations, these departments have to meet, have to interwork. Can't have Demas has one policy that's the exact opposite of DOC or vice versa, it's collecting data. And so that when you find out 85% of people who could have gotten out of CVH, but they didn't because of housing, well, we have to we have to do something. We have to stop talking about it and do something. And I think that's the key to it, is to say, we've all been around this block a lot, and we have to have some powerful body that says that group has the ongoing power to say, we do have to make changes and that we're going to get them done. Be
Okay, Nancy.
responsible.
I think the question I have about all that is the use of the word governing and power.
Mhm.
Because I think that's going to be a real hard sell to various agencies. I think it makes absolute sense that the policies of DEMIS and the policies of
Or whoever, yeah.
DOC, should not contradict each other. And maybe they should have some kind of a legislative reconciliation board. But I'm not sure that when you start talking about this committee as opposed to the oversight committee, I'm not sure that we're talking about something that's a governing board, because a governing board is, you're going to have to start dealing with the statutory requirements of each separate agency, and you're going to have to deal with regulations. The use of the word governing just implies a kind of power and authority that I'm not sure can be done interdepartmentally, even though it makes perfect sense. So I would agree with everything that you said, but I'm not sure that the words governing and power are part of it, that I thought the idea was advisory.
Yeah, and you're right about, the words,
Yeah.
you can, to me, it was more of my point, but I think that's important to make sure we get the
I'm a
right
lawyer,
word.
I pick it
But that's
individually.
good. That's why you're here. That's why you're, and certainly people who have utilized all of these systems needs to be a part of it. People in the process, in the recovery process, or in,
CSSD needs to be a part of it.
yeah.
I'm thinking
Well,
that, go ahead, Paul.
I was just gonna say, it's kind of like the behavioral health partnership, where they bring in DCF, they bring in DSS, they bring in DEMIS, and they bring in all these partners that are, kind of responsible for the behavioral health system of Connecticut from birth to death. And they talk about the issues. And so it might not be the problem that, that they're there for the answer, but, kind of having, like one of the CEOs or something saying something to Bill Halsey about the rates or something, so that the agency actually hears what's going on out there. It's up to each agency to make these changes within it. Because, how many times are you going to sit there and say our rates are too low before you start to look at the rates?
But I think that's the problem. Everyone's just looking at their own agency and their own department. I think that's what I feel like. I feel like there has to be, and again, I'm not sure, it's not the advisory committee I'm talking about for this. That would be specific to Whiting. But to make true change, I just feel like
It's not just Whiting, it's the whole system,
including
community programs. And so what we really are looking for is some leadership here in designing a continuum of care, which includes the helping people in the community. And I don't know, it might be time limited, but the point is somebody's gotta sit down and look at all the pieces and see how they can cooperate and to really, at one time, many moons ago, there were people who did this. They got together and they looked and they said, okay, where do we need this?
Maybe there still is, and I just don't know it. There could be.
I do think there's, Paul, you mentioned one about the behavioral health group, and there's CJPAC. Mike had mentioned some before. So there's certainly models and there's certainly places where I think this happens. I just, I think that with respect to, we're talking about competency restoration, I think it needs to, in other areas of forensic mental health, I think that it doesn't need to be time limited. I think this needs to be like an ongoing thing. And the more people talk about what's happening in our agency and how that affects this agency and how that affects, each agency can be responsible then for, coming up with solutions and policy, policy to institute. But if we're sharing ideas and sharing data and talking about how things affect one another, then that's going to make it easier for each other to come up with those things.
Yeah, and the legislature needs to be involved in this because they aren't going to usurp their power to, you know, this entity. So they need to be there so that they actually develop an expertise in this instead of, oh my God, something happened. What do we have to know about this?
It's like a reconciliation kind of
Well,
truth and
I
reconciliation.
don't know if we can name it, but we can certainly describe, and I think we've had some good thoughts here, describe what we want it to be and who should be on it. So is there, you know, when we sat down and we talked about different aspects of our charge, we wrote these things down and discussed it. And I'm thinking this is a very important part of what we want to recommend, is that somebody, that there's a clearinghouse, an interagency effort to clear and to work together. And I say in some respects, many moons ago, that they did this with the with homelessness, but at the same time, the governor had to take the leadership there, and that, because if you're going across agencies, then it's the governor. So we might make a recommendation that the governor entertain the challenge of actually creating an interagency council, which actually addresses the concerns of the entire forensic aspects of the Department of Mental Health and Addiction, but also you can make a lot of the good things happen if everybody's on the same page and knows what needs to be done. You never know what people have. And I know this is a strange thing, but I'll just say, you know, when I was the Commissioner of Veterans Affairs, I had 3 cemeteries. We had over 1,000 headstones that had not been placed. And I was sitting next to the Commissioner of Corrections. And she said to me, well, is there anything I can do for you? And I'm thinking, no. But we were able to get people on a work program to come and help us from the prison system to help us do that. So sometimes when there's a will, there's a way.
Right. Well, and even understanding that Connecticut has a fairly unique position of actually separating 18 and under mental health and 18 and over mental health, or 17 and under and 18 and over mental health. So there's a disjoint in those systems, you know, going on. And it's the same with the juvenile justice track, you know.
So maybe our recommendation would be, as we looked at this issue, we saw that there are many aspects of the programs that need to be addressed in order to have, you know, a vibrant system of taking care of mental health issues, including the dialogue between agencies to assist with the needs, many needs of the people who are in having issues with mental health.
So
I'd
can I
like
ask
to keep it out of the hands of the governor. I think that politicizes it too much.
sometimes it has to be the governor if you're talking about interagencies, though, I think.
Yeah, if you're going,
The legislature can appoint. I don't know, that's just.
no, if you're asking about the agencies, you
And
have
that's
to
not
get,
political, by the way? You think the legislature's not political? Sorry.
It's a little more concentrated with the governor,
So I have a question, a clarifying question regarding this whole discussion, which I actually fully agree with the concept of creating, and I'm not sure what it is even called, but a multidisciplinary interagency group that involves all the aspects that we've just discussed, right? To coordinate, collaborate, address systemic issues, policy issues, et cetera, right? So I think we're all in agreement with that, but that's not that's, just so I'm clear, is that separate from the oversight
Site, right.
group, right? That we're talking, that's a totally separate thing. And the oversight group, board, whatever we call it, this is the group we're talking about, governance, power. That's the group, I think, if I have it right in my head, is the group that, again, I will use my board of directors as an analogous situation. As the CEO reports to these group, says, here's how we're doing, what we're doing, and that's where the accountability role is. Is that kind of what we're talking about for that board?
I think so. I mean,
I think so. It has to have teeth. It has
And
to
the teeth of
have,
board, the teeth of board has typically, Lynn, as you know, the only actual role of action of a board, when they do a lot of work, but the action role they have is hiring and firing of the chief executive officer, right?
Yeah.
So does this group have that? Will this group have that responsibility?
no.
I mean, that's the ultimate accountability, right? You don't do a good job, you get fired, right?
And so my thing in this is they should have some say. Maybe they don't have ultimate authority, but they should have some say into who gets hired. I mean, you know,
particularly if at some point the top executive positions end up becoming state positions, you know, rather than contracted, then the state would be the one that's responsible for hiring and firing and whatnot. As
Right,
a
I mean,
whole,
right. But
they could certainly be asked to make a recommendation.
recommendations.
right. And because, I mean, giving them responsibility without giving them some power to actually execute that responsibility is kind of moot.
I like
That's my
what the way that Mike had described it in previous meetings, which from what I understood, you know, seemed like this group of people would make recommendations regarding, you know, specific actions that need to be taken and things like that, and create reports, but that require a response from, you know, whether it's the CEOs of the hospitals or a DEMIS spokesperson or the commissioner herself, because then that puts the impetus on them. I guess what I'm getting at is I want to make sure that we don't go too far in saying like they have ultimate authority to make policy or practice decisions that maybe because like the farther you get away from the work, the less effective maybe your policy recommendations may be. So it might make sense to have like, okay, this is what we identify as a problem. This is what we recommend. We want your response in writing as to how you're going to address it. And then that creates a dialogue with the agency and the oversight commission to be able to say, okay, well, here's how we would respond to that. And then they can go back and forth, as opposed to saying, you know, this is what we dictate you do without maybe knowing, you know, the context of the work. So that's my suggestion. Things I think work well when we're able to open up a dialogue between people rather than creating dictates.
Right. And just as long as it's opposite of, you know, like a dog and pony show where they just sit there and it's like, here's the latest in forensics kind of presentation where they actually like, it has to be more than just we're meeting and we're going to get presented, you know, what's going on.
I just want to say, I think that group has to hold accountable the people who are providing the services or the leadership of those services. And so that group has to really take responsibility and understand the system and then hold the system accountable and then be willing to work with the system, forensic system, to know when we need to make changes and how those changes need to happen.
And, you know, I think like Mike pointed out before, having a body that has to make reports quarterly, you know, that gets fed information, makes a quarterly report or an annual report that then has the ability to become public is a pretty good way to hold people accountable. So, you know, I think that again, what I've been hearing from him in recent weeks, when he's talking about the Inspector General and this Oversight Commission, it sounds like, if we recommend that there's a creation of this Office of the Inspector General that fields investigations or complaints and does investigations and then reports to this Oversight Commission, and then they make recommendations that then must be responded to by the agencies. And as I said, this, kind of create this dialogue where things are, people are being held accountable and being forced to respond in some way, but that there's an open exchange of how that gets accomplished.
So how do you see, so the Inspector General investigates and reports to the Oversight Committee, and the Oversight Committee has recommendations. Who do they report to?
Well, you still got the person with the ultimate authority is still the commissioner. So I think that's, where it has to, the buck stops there.
Right. That's what I mean. Like if the Oversight Commission says, okay, here's this problem in this particular facility or in the agency as a whole, you need to address it. They may make recommendations about how to address it, but then and then force a response by the agency. Then the agency has the opportunity to say, well, you know what, that won't work because of X, Y, or Z. Or yes, that will work. Thank you very much. We'll implement that immediately. And then they have a specific amount of time when they have to report back. So it creates.
But if they, let's just say for the sake of discussion that a recommendation is made and the commissioner decides, I'm not doing that.
I think that she or he would have to back that up and kind of go back to the Oversight Commission and explain why, or explain what would be better. Because then the Oversight Commission may look at that and say, okay, yeah, that makes sense to us.
But don't forget, again, we're getting back to the politicization of this. The governor appoints the commissioner. And so if the commissioner doesn't want to do what the Oversight Committee does, and if the governor agrees with his or her appointee, that's pretty much, where, because there has to be a paradigm switch that includes changing essentially the line of authority. And that's not something I don't see this legislature being.
Well, you're getting me to think about the Board of Trustees. The Board of Trustees for the Department of Veterans Affairs is appointed by the governor and advises and sits and advises the commissioner. But also, they actually report to the governor. Is that something that sounds feasible here? Because if in many years past, the commissioners did not listen to the Board of Trustees, so things weren't done. But then it was changed, and now the governor appoints.
Wouldn't a quarterly report take care of that though? Like, we made this recommendation, here's why we heard, here's what we heard back, and just have that in a quarterly report that gets released to the public.
If you're making the report to the commissioners, it can go nowhere if the commissioner doesn't want it to go.
Mm-hmm.
And that's what's happened.
Happened with OPA. Look at how OPA was run. OPA was run by an executive director who was appointed by the governor. And then there was a advisory board, because it was a state agency. It didn't have a board of directors. It had an advisory board. The advisory board was appointed by the governor. So, it all funnels, right? I was saying the buck stops with the commissioner, but it really doesn't. It really does boil all the way up. And the governor is going to do what they want to do. And they may have some input into it if they appoint this oversight board. And if you can arrange it so that there are staggered terms that don't coincide with the governor's terms, then you get a little bit more power in an oversight board, but the bottom line is it's whatever the governor wants.
There are a longer 5 or 10-year thing to make it
Mhm.
different, kind of like an FBI director. Hey, guys, I just want to remind everyone, it's 2:59 and I have another call coming in at 3. Just heads up.
Yeah.
Okay, so how about this? In the interim, if we could just kind of, remember how we passed around what our thoughts were about this, and we saw that there were some things we were gelling around. So before the next meeting, to talk a little bit more about the concept of what we were just talking about, how it would, who the functions, we already have an advisory board, okay? That needs to be pumped up, but the oversight and what kind to conceptualize this other group, which will be coming together to help plan and move the agenda for mental health in the state of Connecticut in a broader context.
Right. And then we still have to get back to the agenda item we added for today that we didn't get to.
Yes, we do.
Yeah.
Yeah, that will be on the agenda.
Okay,
All right. Okay.
Up the agenda for next time.
yeah.
Yes, Lori.
I was just gonna say, I have already started to draft something up. Again, I'm happy to circulate it as a starting point. Expecting everybody to offer their input and feedback and change it and modify it and mark it up red and all that. And then we can talk about all of that stuff next week.
I actually liked when we sent, if anybody had the feeling that they wanted to contribute, that we sent it all in, and then it was put out on a paper where we saw who was saying what. And then we had that discussion. Does that sound like a way to go?
Well, I think redlining works too. If you've got a document and somebody redlines it, you don't need to make fancy charts and graphs.
All right.
I have no issue being ripped to
I think-
shreds. I have no issue with red ink. I'm saying I'm happy to, I put it out there. I've already written something, so feel free to.
Well, I
edit it
think
with-
a lot of people have ideas, so let's just put them down and then pass them around like we did, and we'll go through it like we did the last time. So we
Okay.
want to, what the responsibility and scope for the oversight and the larger context between an interagency body that would collaborate to create a system for mental health and in our state. What do you think? Okay.
Next 2
All
weeks.
right. Thank you all.
All right. Bye, everybody.
Bye.
Bye, guys.
Thank you, everyone.
Thanks, Dave.